If you're pregnant or postpartum, then you probably have heard the term diastasis recti or DRA. This is a separation that occurs within the abdominal region involving the rectus abdominis muscles. Now, before you freak out, this is a normal adaptation that occurs in full-term pregnancies. Now, at some point in time, someone may have told you, or you may have heard, that you should avoid doing crunches if you have diastasis recti. Well, that's not completely true. The reason being is because these muscles are important for various functional tasks. And also, the more we learn about this diagnosis, the more we're learning that the rectus abdominis muscles itself, they can help you recover if they're stronger. So how do you get these muscles stronger? Well, these muscles are responsible for trunk flexion. So they help you to come up this way. They also can help assist a little bit with hip flexion as well. So bringing the legs closer to your chest. Guess what both of those motions involve? Both of those motions involve you having to do a crunch, either it be an upper body crunch or a lower body crunch. So today I want to go over some really simple crunches that you can begin doing in the postpartum phase that will allow for these muscles to heal. Now, please remember, with any exercise, if you're noticing any pain or discomfort, I want you to stop. And also with any exercise, you want to make sure that you're moving within a range that is comfortable for you. So these are not going to be aggressive. These are going to be some of the easier activities that you should start with when you're initially recovering. For our first activity, we're going to go down onto your back. And right now, just to assume that we may not have good core strength, we're going to have you go down onto your side. From your side, you are going to roll onto your back. Once you are in this position here, next thing I'm going to have you do is gently bring your arms up in front of you with your hands clasped towards the ceiling. With this position, we are going to allow for you to lift the head and the shoulders up off the mat. But as you do this, make sure you don't hold your breath. Holding your breath is your body's way of compensating and cheating at times. And right now, we're not doing a strenuous activity, so we have no need to try to hold our breath as if we're lifting 300 pounds. So when you do this, I'm going to have you take a breath in. And on the exhale, we're going to lift our head and our shoulders lightly up and exhaling here and then coming back down nice and slowly. Good. Inhaling again. Exhaling, lifting the head and shoulders up and back down nice and slowly. Now, as you begin to do this, you should feel those abdominal muscles tightening. You can progress this activity by allowing for a muscle below called your transverse abdominus to also activate. In previous videos, I showed you how to activate this muscle. So right now, I'm just going to give you a brief cue, and then I'll link the other videos below so that way you'll have that as a reference. In order to activate that muscle, I just want you to gently pull your belly button down towards your spine. Make sure you're not holding your breath. And now we're going to repeat the motion that we just did, keeping that transverse abdominis muscle activated, and now crunching up gently to activate our rectus abdominis muscles as well. So you're going to take a breath in. And exhale, lift the head and shoulders up. Good. And coming back down. Good. Inhale. Lift the head and shoulders up. And coming back down. If you're noticing it is hard for you to activate that transverse abdominis while you perform that crunch, start with activating that muscle first. Once you become more proficient at activating that muscle, then try to combine the two. For the next exercise we're going to do, you're actually going to lift the legs up. Now, if you're not strong enough to hold the legs up, you can easily support the feet against the wall, or you even can have a few pillows so that way they can help support your legs. If you're laying on the ground, a great place to do this if you're needing leg support is right in front of the couch, so now your legs can just rest directly on the couch. As you are in this position here, I'm going to now have you bring your hands just up towards your head. Now notice I'm not cupping and grabbing the head, but my hands are just here. I like this position because I'm able to, one, open up my chest a little bit and give a little bit of stretch through here. But now I'm also able to focus on how well I'm lifting my shoulders up off the ground. What you're going to do in this position, same thing we just did. If you're able to activate the transverse abdominis muscle, gently pulling in with the belly button. If not, focus on one at a time. But you're going to take a breath in. And as you exhale, you're going to lift the head and shoulders up. And now we're going to hold for 1, 2, coming down. Good. And we're going to do that again, taking a breath in, inhaling. Lifting the head and shoulders up as you exhale and holding 1, 2, and coming back down. Changing the angle of the legs here can allow for a different activation pattern of the rectus abdominis muscles. So as you become stronger, then if you're using support, I want you to start trying it without the support. You can move to using less pillows or even decreasing the amount of pressure that you have your feet against the wall with. For the last exercise I'm going to show you, it's going to be very similar with the starting position that we just did, with both legs either up, free in the air, supported against the wall, or against the couch or using pillows. Remember that you're starting at a place where you feel comfortable without straining and without pain. So I want you to go into the position that works best for you. If you need to support the legs, please do so. And as you get stronger, you'll be able to remove some of that support. So with the legs here up in this position, I'm going to have you now gently push one knee into your hand. I'm going to use my left hand to push my right knee into that. Now I'm able to not only activate my rectus abdominis muscles, but also getting a little bit of the obliques because of the diagonal pattern. With this here, you're just going to gently push, and we're going to hold that push for 5, 4, 3, 2, 1, and then relax. You can alternate sides or you can do each side individually. So now I'm going to use my right hand to push my left knee into that. Now notice I am not moving. What I'm doing is an isometric contraction, so we're just using the muscles to help tighten so that way we can get them activated without actually having to change the length. And now going back over to the place where we started, my left hand against my right knee. Good, and gently pushing and holding for just 5 seconds, making sure you're not holding your breath. Good. And then switching to the other side, my right hand against my left knee. Good. And coming down, you can bring the legs down to take a break and relax. With each of those exercises that we just went over, I want you to try to do between 15 to 20 of them. Now, if you start to fatigue and the muscles itself are not able to activate as well, go ahead and give yourself a break. The great thing about this is your recovery is paced based upon what's best for you. So do exactly what your body is telling you. If your body is telling you to push a little bit more, feel free to take away some support or even activating additional muscles like we talked about. If your body's telling you to modify, make sure you listen to that as well. So there are different suggestions through the video that will help for you to modify, especially for the ones where you're having to hold the leg up. So as you're looking to recover and get back to doing full crunches, give these exercises a try. Starting off with baby steps so that way you can build up to those full crunches is going to be important to make sure you're able to manage the pressure and also perform those activities correctly. Let me know if you have any questions below.